One of the things that, causes sometimes confusion is that orthopedic surgeons who do spine surgery or neurosurgeons, okay? And the answer is both. So there's orthopedic doctors who do spine and the neurosurgeons who do spine, okay? And a lot of times people say, well, who's better? And I can tell you, I don't think there's any very simple way to answer that. The reason why, because I've met lots of neurosurgeons in my life who are very good. I've also met a lot more neurosurgeons who are horrible at what they do. I've met some great orthopedic spine doctors, and I've also met some horrible orthopedic spine doctors. So I don't think it's about whether you come from a neurosurgical background or orthopedic background. It's about, again, all those factors that we talked about before. Who you are, your skill level, your training, your ability to make the right decision, your ethical standards, which is, we didn't touch upon that, but it's extremely important in spine surgery. What are your ethical standards? And what I mean by that is that, do you do for the patient what you would do for your family member, for your mom, for your dad, for your sibling? Or is your indication for the patient different for whatever reason? Is it financially driven? Is it something else? So it's extremely important, and you got to ask yourself as a doctor every time you see a patient, is this what I would recommend if it was my mom, my dad, my uncle, my best friend? Or is my recommendation different? And if your recommendation is different, maybe there's something wrong about how you practice medicine. So the ethical standards of your recommendation of your practice is extremely important. And I hate to say it, but it's very often deviated from.